When I meet with patients for the first time in the office, I've noted that there's a huge variation in what their baseline diet is and what they've been eating the last 6 months, a year, even 5 years before they've come in to seek treatment for either weight loss surgery or just some nutritional counseling. And on one hand, we've got some patients who are eating a lot of fruits and vegetables already. They eat very clean. They're very conscientious about their food choices, and they spend a lot of time planning and preparing their meals. On the other hand, we have what I call modern day foragers. Now, if you're a forager in the caveman times, then you're going to walk around and you're going to eat nuts and berries and whatever else you can get your hands on. But if you're a forager in modern day times, you basically are driving around and whenever it's time to eat, you kind of pull over, either go through the drive-through or run in and grab a quick bite. And as a result, you're going to eat a lot of fast food. So really what I find is that most people who are eating a lot of fast food and processed food are doing so out of convenience, not really a preference. And as a result, they just aren't putting enough time and energy into choosing better foods, shopping, and preparing healthier meals. So how does this impact whether or not you should have weight loss surgery? If you're someone who's already eating a lot of broccoli and a lot of fruits and vegetables, how is that going to impact things compared to if you're someone who's eating a lot of fast food or processed food and really has a tremendous amount of room for improvement in their diet? Well, it really gets back to this fundamental discussion, which is surgery necessary in order for you to lose weight? Or are there other less invasive methods like diet, nutrition, exercise, and medications? And when we take someone who's eating a processed diet and we get them onto our Pound of Cure program, what we can see is a substantial lowering of your set point just from that nutritional change. Because we're not making a small nutritional change, we're making a huge nutritional change. Going from primarily a fast food and sugar sweetened beverage diet to the Pound of Cure program like we've talked about in those other nutritional courses, that's a huge change. And as a result, we often get a lot of weight loss. Now, if we take someone who's already eating really healthy and we get them onto our Pound of Cure program, which is generally still an improvement because it's a rigorous program and it requires a lot of change. And as I've told you in many videos, I'm not going to tell you that this isn't easy. I'm just going to tell you that it's possible. So when we make those further changes and push things along, typically we don't see as much lowering of the set point because we haven't made as much change. So there just isn't that much more room to improve their diet. As a result, we're generally not going to see as much weight loss from further nutritional change, which means that we're more likely to require surgery because surgery happens when we can't change it through other methods. So if there's just not as much room for change, then we're going to have to look at other ways to do this, like surgery. So if your diet consists primarily of processed food, the first thing you must do is change your diet without question. That is step number one if you want to pursue bariatric surgery. Fix the diet first, see what happens. If you still are struggling with your weight, well, then it's probably time to seek some additional treatment and move forward with weight loss surgery. If you lose a lot of weight just by changing your diet, well, then you don't need to have surgery and this question is answered. On the other hand, if you already eat a really good diet, the chances are that you're going to need surgery to lose a substantial amount of weight because there's just not that much opportunity for change. So I think a final point about this discussion is, can weight loss surgery help me change your diet? And this is a slippery slope because on one hand, I'm saying we got to change the diet first, but on the other hand, I'm also saying, yeah, but the surgery can kind of help you along. And what I found is that the surgery oftentimes changes your taste preferences toward foods that follow the fall in line with the Pound of Cure eating program. This is in fact where the whole idea of the program came from, just listening to patients talk in the first year or so after weight loss surgery about how their tastes change and recognizing that those taste changes were driven by these hormonal shifts, and this must be the types of foods that trigger the most weight loss and that your body wants to eat if it's trying to lose weight. So if we have surgery, it's going to help lead you along the path toward that Pound of Cure program. However, if you fight it tooth and nail and say, you know what, I still don't have the time to do this, I'm used to my fast food, this is just how I eat, this is how I've always eaten and how I'm going to always eat, well, that's going to be a problem. That's not going to work out very well for you on many levels. However, if you say, all right, I'm making some changes, I get this, I want to do this, I'm having a hard time because I still really desire a lot of the sweetened foods and processed foods, but I would be open to a change. Now when the surgery comes in and really helps push you along, you're welcoming these changes that are happening and you're embracing it and changing your lifestyle with that little bit of assistance. And that to me makes sense, but you have to have an open mind about it and you have to set as a goal further change in your diet after surgery. A final point about this is that the two surgeries that we're going to discuss in detail, we'll discuss some other ones as well, but the gastric bypass and the sleeve gastrectomy have differing abilities to push you along toward that healthier diet. A gastric bypass, in my experience, typically causes a little more of these taste changes than a sleeve gastrectomy. So oftentimes when I'm working with patients who eat a largely processed diet and we're kind of moving in the right direction, we're not seeing quite as much weight loss as we would want, we'll use that information about how much weight they've lost in terms of deciding on which procedure that we're going to move forward with. And we'll talk a lot more about this in further videos.